Hello, welcome to the ITPC webinar, Making Data Work, Strengthening Community-Led Monitoring in Ukraine and South Africa. We are very happy to have you here today. My name is Jelena Bujinovsky. I'm Program Manager at ITPC Global, based in Malawi. And distinguished speaker today will be my colleague, Krista Lauer, who will setting up the context and giving us a bit of the current state of affairs in the world as an intro and a segue for what are we here actually for today, and that is the impact of community-led monitoring in two very different contexts. We will start with Ukraine, and my colleague Sergey Dmitriev, Executive Director of Health Advocacy Coalition from Ukraine, will give us a little bit of background and context from the Ukrainian side. And after that, my colleague Melikaya Sobiasi from NACOSA from South Africa will provide a background from the South African side. And our main principal investigator, Dr. Misut Suma, and the lead writer of the manuscript on this topic will give us the key highlights and points, provide us with the main points of the research that we did in the last few months. Next slide, please. We just wanted to provide a little bit of yes, it's very important to mention that ITPC was not the only guilty party for this manuscript today. This work would not been done possible without support from the International Aid Society through an investment from the Gates Foundation. So we are very grateful for this support. Just a brief outline of the agenda for today, which I already basically said in my introduction. Krista will provide framing remarks, then Sergey, Ukrainian background, then Melikaya, South African context, and the main heart of the research will be presented by Dr. Dmisut Suma and then we will really try to have time for the Q&A. We try to leave 10 minutes, but hopefully even more if we are on time. We will try to really be on time today, and then the few closing remarks and group photo by Krista. A few housekeeping points for the webinar today will be, please use the chat box to introduce yourself. I see the numbers of the participants are increasing as we're speaking, so please use the chat box to introduce yourself. But also, we know that the new world order we're all in, and there's the information have been flowing from second to second. So if you feel you would like to share anything with the group, please do so. We will read all of the chat comments, information, and points at the end by ITPC, and maybe share later with all of you. And then there is a Q&A box. We strongly encourage you, due to the limited time, to use Q&A throughout the presentation, and our panelists will try to answer live, but what not, we will try to answer later in the Q&A. We will also be providing a hand for you. And do not worry, slides and the recording will be made available after the webinar. And then we will have this webinar available in 3 languages. English, we will speak in English, but then we will also have Ukrainian and French. So you can use this little bottom at the little kind of earth sign on the bottom. Important point is we could not locate Ukrainian, so it will be here as Japanese. So we have Japanese and French. That is it from my end. So without further ado, I would like to give a hand to my colleague Krista to provide us with framing remarks and where are we today. Thank you, Krista.
Hello, everyone. Thank you for joining us on the webinar today. Before we start, I just wanted to set us in the context. So political landscapes deeply affect our access to data and data transparency. And political landscapes can change incredibly quickly, as therefore data landscapes do as well. So I'm going to give a very quick flash briefing right now on the current political and financial landscape that is affecting us all, because it does shape our access to information. So, as everyone knows, on his first day in office, President Trump signed a number of executive orders, and on January 24th, signed a stop work order, a 90-day hold, seizing all foreign aid support until programs were reviewed. It was unexpectedly extreme. Not only did it stop future funding opportunities, but it put a hold on already distributed funds. So many NGOs around the world, HIV service implementers, key populations drop-in centers have money sitting in their bank accounts that they cannot use that was appropriated last year. And the first question, of course, was, is the PEPFAR program affected? And indeed, it was. So 2 waivers have been issued so far, unless things have changed overnight, but they were incredibly vague. So the first one was only 1 page long, and the second, which was only 3 pages long, was also quite vague. And yet the wording was very strict. Things like any other activities not specifically mentioned in this guidance may not be resumed without express approval. This had a chilling effect as implementers around the world were fearful of putting a toe wrong and having all of their programs funds seized or the entire program at risk. Normally, there would be communication from Washington, D.C. headquarters with implementers around the ground, and that didn't happen this time very effectively, precisely because foreign aid staff are being removed. There are a couple of tweets here from Elon Musk, specifically targeting USAID. One saying, "We spent the weekend feeding USAID into the wood chipper," and another saying, "USAID is a criminal organization." And there has been a systematic removal that began at the end of January. But if you go to the next slide, is becoming very, very significant. So as of February 6th, the estimation was that 10,000 USAID staff would be reduced to less than 300 positions. Now, late last week on Friday, there was a pause order applied by a judge that would protect 2,000 USAID employees who had been put on leave. But that leave expires on February 14th, on Friday of this week. So a drastic change in landscape and who is supposed to be sharing information. Next slide. In response, the administration, the Secretary of State, Marco Rubio, said, if some organization is receiving funds from the US and doesn't know how to apply a waiver, then I have real questions about the competence of that organization. So there's a lot of confusion, vague terms, strict terms, and now an accusation of incompetence if partners on the ground can't figure out what this all means. And just yesterday, there was a new brief put out by Data, Etc. and PEPFAR Watch that shows the context on the ground. So 70% of respondents to their survey haven't received any official communication. And there's a quote here that says, imagine resuming work, and then later you're told to return the spent funds because you acted without being instructed that you could. And according to their analysis, only 5% of partners have been told whether they can resume services or not. I realize this was very quick. It's a complex situation, and this is just a flash briefing. But the point that I really want to emphasize today is that data landscapes can change incredibly quickly as political landscapes change. So you may have joined the call today thinking that the data landscape in your environment is either closer to that in Ukraine, which we'll be discussing today, or closer to that of South Africa. But the truth is, you could be one or the other in the blink of an eye. And this is one last example where the Centers for Disease Control began removing key information, including guidelines for use of HIV medication and vaccine advisory information. And the quote here from the Washington Post is that the data's removal will have implications for researchers who have relied for decades on the comprehensive material collected by CDC. So with all that in mind, I want to hand over to our esteemed panelists and thank you for being with us today. Sergey, unfortunately, we are not able to hear you. I believe you may be on mute.
Да, Елена, спасибо. Я думал, после Кристы ты. Спасибо, Елена, спасибо, Криста, большое за анонс той работы, которую мы делали совместно с вами. И я сейчас попробую представить то, что получилось в Украине в контексте СЛМ. Так, выведена, да, презентация? Угу. Так, сейчас, спасибо большое. Секунду. Я исполнительный директор, меня зовут Дмитриев Сергей, я исполнительный директор коалиции «За право на здоровье». Мы работаем в регионе Восточной Европы и Центральной Азии. Я хочу сказать, что на самом деле внедрение СЛМ происходило в нескольких странах. В странах Центральной Азии, Казахстан, Кыргызстан и Таджикистан. И, соответственно, в Украине. Нам хотелось бы все-таки отметить тот опыт, который получился в Украине, более, скажем так, живой и институциализированные уже данные с помощью наработанных программ СЛМ в Украине, поэтому Украина получилась основной нашей страной. Так, секундочку. Я хотел бы сказать немного о организации, два слова. Основная наша цель организации — это все-таки всеобщий охват услугами здравоохранения в регионе. И в этом плане мы успешно продвигаемся. И наша миссия — это все-таки ускорить прогресс достижения всеобщего охвата услугами и повышение роли в принятии решений непосредственно сообществ, которые как раз задействованы в СЛМ. И СЛМ мы считаем один из важных факторов как инструмент поднятия capacity организации неправительственного сектора. И, соответственно, те данные, которые нарабатывают организации, они должны приниматься государствами в тех странах, в которых это происходит. В Украине до 2022 года по оценкам, оценочное количество ВИЧ-позитивных людей 250 тысяч. И концентрированная эпидемия в Украине — это все-таки среди потребителей инъекционных наркотиков, работников коммерческого секса и МСМ. Основные проблемы — это недостаточная профилактика, стигматизация, дискриминация, ограниченная правовая среда, тем более в условиях войны, которая сейчас, к сожалению, в Украине с соседом не очень здоровым, это Россия. СЛМ выявил проблемы в обслуживании, выступил за доступ к АРТ и защите прав ЛЖВ, а также в контексте заместительно-поддерживающей терапии. И, собственно, какие же практики СЛМ использовались в Украине во время гуманитарного кризиса в 2022-2024 год? То есть удаленный мониторинг и цифровые решения, то есть диджитал-инструменты, которые существуют в Украине как минимум 5 у представителей сообществ, они помогли на самом деле получать информацию и оккупированных территорий, и с территорий, которых временно не работали социальные службы. И фокус все-таки был на перемещенном населении, потому что как внутренняя миграция, так и внешняя в Украине происходила и происходит до сих пор, поэтому эпидемия перемещалась. И поэтому доступ к услугам был в приграничных районах ограничены, и зачастую люди из военных территорий передвигались там, где нету военных действий, не было на тот период. Какие же проблемы и какие уроки, наверное, если вкратце, можно обрисовать с помощью, благодаря СЛМ, которые использовали сообщество в Украине, это все-таки риски безопасности для сборщиков данных, целостность данных в зонах конфликтов и ограниченный доступ к населению. Поэтому в дальнейшем мы рекомендуем и на данный момент разрабатываем все-таки цифровые инструменты. Это это инструменты, которые будут очень просты в доступе через обыкновенные телефоны, не громоздкие, которые могут с небольшим интернетом все равно использоваться с людьми. Это гибкая разработка инструментов, то, что я сказал раньше, сильные общественные сети, как в Украине, данные в режиме реального времени для адвокации, потому что те данные, которые сообщество аккумулирует, главное и основное, это чтобы государство эти данные использовало, и в Украине как раз сформирована платформа на базе Центра общественного здоровья и группа сообществ всех представителей вместе с представителями власти для того, чтобы эти данные использовались для изменения политик и усовершенствования программ. Ну и про устойчивость и масштабируемость, это, конечно, обеспечение того, чтобы индивидуальные практики СЛМ выдерживали текущие кризисы и адаптировались к аналогичным контекстам. И хочется сказать в завершении, Криста этого коснулась, мы все понимаем, что основные доноры, в том числе Украины и региона, это глобальный фонд, это ПИПФАР, это USAID. Последние мы на данный момент исключаем из формата финансирования и помощи сообществам, так как USAID расформировывается. Программа ПИПФАР через CDC стоит на паузе. И следующий сбор глобального фонда денег, ну, наверное, точно не будет таким впечатляющим, как текущий, поэтому все будет оптимизироваться на лечение и на услуги. И вот здесь как раз СЛМ с его оптимизацией, с диджитал-инструментами, это как раз тот инструмент, который мы считаем будет как держать на плаву сообщество для, что ли, держания руки на пульсе по предоставлению качественных и необходимых услуг для сообщества. И, собственно, само сообщество не перестанет существовать без какой-либо внешней поддержки финансовых ресурсов, технических и тому подобное. Ну, на этом, наверное, все. Повторюсь, СЛМ сейчас как никогда важен и актуален. Будут вопросы, я с удовольствием на них отвечу. Спасибо большое.
Thank you, Sergey. Thank you so much. This was very informative. I know we are very tight on time and it's a compressed, a lot of information, but we will have more time even during Dr. Dmisu's presentation and also in Q&A. One more time to remind everyone to use Q&A box if any questions directly for Sergey or Yevgenia from Health Advocacy Coalition or Melekaya and Colleen from NACOSA, or Dr. Dmisu or any of us or ITPC. Just use Q&A box and we will try to answer live. Now, thank you so much, Sergey. Now I would like to introduce our colleagues and our colleague from South Africa to present the other side of the world context and different challenges and different success stories. So over to you, Melekaya. Thank you.
Thank you so much, Yelena, and also thank you to Krista for laying the foundation earlier on, and then also Sergey in terms of just giving us the Ukrainian context. My name is Melekaya Soboyesi. I'm the program manager for the community-led monitoring program, which we are implementing in South Africa, and particularly in the West Rand district. Next slide, please. So I'm just going to give a small background, a brief background about NACOSA, or rather in South Africa, where we've been implementing CLM. So NACOSA is dedicated to strengthening communities by addressing HIV, TB, and gender-based violence. Our focus through community-led monitoring is on treatment and prevention, particularly for youth and key populations. And this work is done in collaboration with the South African National AIDS Council, the National Department of Health, the West Rand District Health Services, and a key community partner, such as Rotanga Netsa Community Care and Access Chapter 2. So in terms of our socio political context. South Africa currently faces significant health challenges, with one of the highest HIV and TB burdens globally. So the National Strategic Plan for 2023 to 2028 sets a bold vision for us in eliminating HIV, TB, and STIs through stronger prevention, treatment, and community engagement. However, a key concern is the healthcare system's inequality, particularly in rural areas where access remains uneven. With the recent implementation of the National Health Insurance, we hope to see early steps towards universal healthcare. Though many challenges remain, importantly, partners between the government and civil society are shaping how health programs are delivered on the ground. Next slide, please. So we've been implementing community-led monitoring in 3 sub-districts in the West Rand, looking at 7 facilities in Mohale, City Sub-District 5 in Rand West City, 3 in Merafong City, and through a data-driven advocacy, where we actually also saw some of the intersectionalities between reported gender-based violence and how it relates to HIV. We also looked at the clinical forensic medical services across the 3 sub-districts, one in Leratong, at Leratong Hospital, Bakersdale West, and then also Carltonville Hospital. And then also from a triangulation point of view, we were also collecting community data. So by community data, these would be data that is collected from non-governmental organization partners, such as Rodanganetsa Community Care, which is a PLHIV-led organization, Tsapayabana, which is a key population-led organization, and then also Boitudolisedi, which is one of the organizations that look at stigma reduction. And then also, we were working with 19 data collectors, or rather what we call field researchers, who are also supervised by 2 supervisors within the 3 sub-districts. And then we've been doing this work for 3 years now, from October of 2020 to December of 2024, looking at treatment, prevention indicators, more than 20 within the West Rand district. And then also, just like most CLM work, we're also looking at qualitative and quantitative indicators. Thanks, Miriam. So the main purpose for a CLM program was one, can you please scroll again? Was one, to improve access to quality of HIV prevention and treatment care services for people living with HIV. I think just like what we are currently seeing with the PEPFAR stop, during that time, we're actually looking at how service quality had reduced during the COVID-19 pandemic, and how we could actually yield better health outcomes from there. And then secondly, we also wanted to demonstrate, disseminate critical elements of effective local community-led monitoring in South Africa. And I think from the time we've been implementing this project has definitely built on relationships with community groups and government that has been established since then. Next slide, please. So some of the key achievements, or rather key outcomes that we have seen through this cycle is that we saw increased demand for HIV services, where NACOSA did train CLM implementers and health facility worker champions through our training institute, improving on the data collection and management. Secondly, through increased evidence-informed advocacy, we saw that the combination of training, learnings, and CLM experience led to stronger advocacy driven by reliable quantitative and qualitative evidence. So In the CLM cycle, we always had a process where we actually have a community consultative group sessions on a quarterly basis. So this is where we would have your local AIDS council or your district AIDS council members, have the Department of Health, and then also other community leaders and also NGO implementers within the relevant district, where we shared CLM data and also came with effective informed advocacy. And then also, I think, based on some of the prior published work, where we spoke about the 5 impact stories from South Africa, we found that targeted advocacy efforts at local, provincial, and national levels resulted in community-led monitoring that helped to foster local innovation and improvements in routine health screenings and testing services, medical care and treatment, prevention, and support services. As I said, I think one of the great impact stories was seeing more of women giving birth at the CLM monitored facilities, more women reporting earlier before 20 weeks at the facilities, and then also through some of the community data-driven initiative, we started seeing more men accessing HIV testing services. And then also one of the, I think, great groundwork that we've also seen is increased government accountability and investment in CLM. I think most importantly, we saw that the West Rand Department of Health had fully embraced the CLM concept, actively using the insights and from the program to shape and improve their service delivery. And also their commitment remains strong, as they will continue to working closely with local civil society organizations like Rotanganetsa Community Care to drive meaningful change. I'll stop there. Thank you.
Thank you very much, Melekaya. Thank you. And now we are coming to the heart of our presentation today, which is actual highlights from the research that Dr. Miso, together with the team and in both South Africa and Ukraine, has done in the last few months. So without further ado, I will hand over to Dr. Miso, and he will also give you a brief update on what's coming next. Thank you. Over to you, Dr. Miso.
Thanks a lot, Elena, and also thanks a lot, colleagues, for laying a foundation. My name is Dr. Ndumiso Chuma, and I'm the principal investigator for this particular work from Best Health Solutions. So, as indicated, I'm going to be covering just some major highlights on this busy slide. You would find that it tries to summarize some of the work that has gone into this, where we have put together a manuscript that is going to be articulating the roles of community-led monitoring. It would also talk to some of the challenges in terms of CLM implementation, and also is going to talk about strengthening community and stakeholder engagement. But over and above that, we are also going to be having aspects to do with CLM beyond HIV programs, where we talk about CLM being implemented also in social and legal spaces. So that would be the detail of the manuscript. And then in terms of CLM, so CLM is actually a process where communities take the lead to routinely monitor issues that matter to them. And this involves gathering evidence, aspects to do with the community engagement and advocacy, and coming back to the actual education of the communities and driving change, working with the various stakeholders in the communities. In terms of this particular work that we did, this study, we employed a qualitative approach where we did a comparison between what is happening in the Ukraine and South Africa, and we learned some of the we used a participatory framework in terms of gathering information. And then we also did in-depth interviews with key stakeholders in both countries, in both sides. Then thereafter, we did a thematic analysis. The purpose was to assess CLM implementation, the challenges, and the impact in Ukraine and also in South Africa. And the sites, the two distinct sites, as indicated earlier on, the colleagues, they've laid a very detailed foundation around the differences between the two sites. But predominantly from the Ukraine side, the primary focus was around harm reduction and also ST, whilst in the South African context, the focus was primarily around improving service delivery and targeting under-resourced public facilities. And then part of the findings, like I said, I'm not going to be going into detail around the findings from this work, but I will talk to some of the aspects. And the starting point, it's actually the data collection component. So it came out strongly that there is active involvement of communities in the process of data collection, where key population groups, they are actively involved in these particular initiatives. And one of the field researchers from South Africa indicated that our team engages with patients to understand why service uptake is low. So there is that alignment between the current challenges that are currently facing the communities or the service recipients and the need that they are having to say, how do we resolve those particular challenges at a grassroots level? And then once data has been collected, the next phase is the analysis phase. I must say that one of the key things that came out strongly is that, yes, data analysis is currently happening, but there is limited expertise when it comes to in-depth further analysis. For example, you would know that when it comes to big data, communities might not be having those level of high-level expertise. Be it is the use of quantitative or qualitative software packages like the use of Atlas TI or NVivo or any other machine learning tools where they can look at data from a bird's eye view and be in a position to analyze big data that comes from the CLM work. So there is wealth of data that comes from the communities, but there is a limitation in terms of how far they can do the analysis. And this came out from both the Ukraine context and also the South African context to say that, yes, preliminary data analysis, basis data analysis does happen, but there is a need for more investment in this particular space, because you would know that at the present moment, there is a limitation. There are limitations in terms of ease of access to some of the national or international data, but that community level data would come in handy at this particular stage if we upskill, if we resource our community organizations that are collecting grassroots level data. One of the experts from Ukraine indicated that many organizations don't have staff to analyze trends and extract actionable insights, which is a need that needs to be covered within the communities. And then thereafter, it's actually the utilization of data, unlimited. The ultimate goal for CLM data collection and analysis is to inform decision-making and shape policies, and also to improve health service delivery. So one of the challenges is around the underutilization of data, particularly when it comes to advocacy. It does not mean that it is not happening, but it is not happening to the expectation of the implementing partners. And then in some cases, you find that there is actually a disconnect between the data collectors and the policy teams, which might mean that there is a need to have that close working relationship so that in all the contexts, in all the communities, that tends to work up smoothly. And also there was a comment that says that with strong advocacy, data remain, without strong advocacy, data remain unused. And then the other aspect was the aspect to do with bridging the gap between the current CLM, which is primarily focused on health aspects, and the need for it to move towards not just focusing on health, but also talking about human rights and access to justice and legal issues. Because in some of these cases, you'll find that in Ukraine in particular, one of the key things was around documenting of legal barriers, which came out also strongly, and also advocacy for justice reform in the South African context. So HIV services are intertwined with human rights issues, and this is one of the codes that came from the UK context. And then CLM for addressing GBV, South Africa exposing GBV response gaps. So as they were implementing the CLM program, one of the key things that came out was that CLM data exposed the GBV gaps, pushing for a much more coordinated approach. Like I said, there is an aspect that says that different programs that are currently being implemented in the communities have got an interlinkage with health. You would know that social, legal, and all of those aspects need to be brought together into one community-led monitoring program. And then the role of digital tools in CLM, Ukraine, use of digital tools also came out strongly to say that it brings in efficiency. So digital tools improve efficiency, but face challenges. So in some cases, issues to do with connectivity. In some cases, issues to do with lack of resources to do so. And then other challenge was around the challenges of digitization. You would find that in some cases, there is actually no infrastructure, as you would know, in the Ukraine context, because of the current unrest, the current instability. It affects the ability to have the infrastructure in those particular communities, but also issues around data security concerns. And one of the field researchers that was interviewed indicated there is a need for a stronger encryption and data backup when it comes to the work that gets to be done at a community level. But of course, the primary challenge centers around that. Thank you. And then, of course, one of the big ones is around donor diversity, funding sources. So there is too much dependence on some of this global funding, and it actually affects the practical implementation of the program, particularly in incidences where there are all these stop work orders or any other challenges that tend to be faced. And there is a need for us to come together and say, who are the other potential donors? Where else can we access resources for us to be in a position to sustain these great initiatives that are being done at a grassroots level? How best do we ensure continuity of these particular programs? Issues to do with long-term sustainability and sustainability in terms of funding of these particular programs. Without aligned funding, CLM risks being a reporting tool. So there is a part that says that in the communities that we serve, how else can we sustain the funding? Apart from the HIV funding, how else can we sustain the funding? Can we be reaching out to the pharmaceutical companies? Who else should we be reaching out to? Who are the other potential funding agencies? Should we be reaching out to government departments? Who are the other potential funding sources that we can tap into? Next one. And then in terms of the future direction, this aspect talks to the future direction with CLM beyond healthcare, where we are seeing CLM playing a key role in terms of policy recommendation, be it's at a grassroots level, be it's at a national level, because the interventions that are being recommended by the community members, that are being recommended by these field researchers, they drive localized change. And some of those could easily become policy recommendation. And also the aspect to do with cross-sector collaboration, where we need to bring in people from the legal, from the social, from the cultural, from the other, to come together and work together in the CLM. And also aspects to do with enhancing capacity. Like I indicated, there is a need for increasing research capacity, increasing the ability to analyze data, to further crunch the data so that we can disseminate quality data. And then, of course, integration with M2M&E systems, localized M&E systems, or national level M&E systems that would allow for the data to be used much more effectively to influence programming and policies that are being crafted at a national level. In conclusion, CLM is critical for HIV/TB legal and social program, and there's a need to focus on the integration, sustainability, and collaboration. And one of the officials indicated that the voices behind CLM data shape strategies. So there is a part that says that CLM is the gateways through which the voices of the communities could potentially be heard much broader than what is currently happening. And thanks a lot for this opportunity. As I indicated, we'll be consolidating all of this work and generating a manuscript from that. Thank you.
Thank you very much, Dr. Misu. That was very clear and succinct. And like we said, yes, there's full report will be available on ITPC CLM Hub, but also we will generate the article that will be submitted for peer review and for publishing. So we will also be sharing that link with everyone participating today as soon as it's published. The timeline for that is fortunately still unknown, but we will, because publishing takes time on the journal articles, but we will submit that very shortly. And now I would like to open the floor for Q&As, and I would like to ask our panelists to put their cameras on, because we have tried to tackle some of the questions, like we said, throughout the webinar on the Q&A chat box, but we will also try to open the floor for our participants to raise their hands and ask the question. And there are a few questions that have stood out to be asked here on the plenum. There was a question, maybe I can ask and then see. I think Melekaya from NACOSA has already answered in the Q&A, but maybe for Sergey, Dr. Misu, maybe Krista. So it's of course related to the recent stop work order. And the question is, how is it affecting ongoing CLM efforts, and what strategies are in place to mitigate disruptions in community monitoring and advocacy? So basically, are there any ways, according to your views, to secure CLM despite the closure of the USAID funding? What are the best mitigation strategies from your context, from your perspective? And maybe quickly, Melekaya, to you, because you already answered it, just can you, so everyone can actually hear your response, and then we can move to Sergey. Thank you.
Okay. Thank you so much, Yelena. I think in South Africa, one of our biggest CLM implementers is actually Richardze, right? And I think most of their funding actually comes from USAID, right? So already with the work stop order, that actually did not only stop them, but also other CLM partners that are operating across South Africa, right? I think one of the biggest things that we need to think about now is how do we actually sustain CLM in regards to how we incorporate it within the government system, but making it very exclusive to the community, right? Meaning the community would still be able to lead the process, right? So for example, some of the PEPFAR data as well and the systems are actually closed, but we actually need systems in which are very exclusive and separated from the government system, so that the community can be able to monitor data that actually improves improves in terms of their own lives. Thank you.
Thank you, Melekaya. Sergey, what is your perspective on this matter?
Да, хороший вопрос. Я думаю, мало кто может точно ответить на него в последнее время, но я хочу заметить, что на самом деле USAID и программа PEPFAR работали не во всех странах. Что касается региона Восточной Европы и Центральной Азии, они работали в части стран, и, конечно, там все финансирование, весь ресурс, который был от USAID на CLM, а они активно поддерживали community-led мониторинг, как в Таджикистане, то есть в Центральной Азии, Таджикистан, Кыргызстан, и Казахстан, да. И там в одночасье все рухнуло. Был в чате вопрос по поводу, насколько это может финансировать государство. Ну, мой ответ, мое мнение нет, потому что это определенный конфликт интересов, потому что зачастую государство предоставляет услуги, которые необходимы нашим сообществам. Но мониторить надо, и на самом деле, это, наверное, время для поиска новых доноров. Это время для того, чтобы приоритизировать community-led мониторинг у глобального фонда, потому что, как мы видим, если по региону Восточной Европы и Центральной Азии, не очень хорошо был поддержан CLM в рамках страновых заявок, эпизодически, только где сообщество более сильное продавило, но в общем этого все равно недостаточно. Я думаю, на данный момент надо сообществам как раз концентрироваться непосредственно на CLM и вот именно бюджетировать эту линию. Чем-то придется пожертвовать из деятельности, которую осуществляют сообщества. Это моя точка зрения. Новые доноры, оптимизация, и взаимодействие с государством однозначно. Я хочу здесь сразу еще зацепить второй вопрос по поводу контроля качества данных, какие инструменты, все остальное. На самом деле необходим в каждой стране должен быть страновой протокол. То есть протокол, то есть те данные, которые необходимы для изменения политик в контексте улучшения предоставления качества услуг, приостановления эпидемии в конкретной стране, все, что влияет на доступ к вторичной, третичной профилактике, все, что влияет на доступ к диспансеризации, к тестированию и к лечению, и, собственно, то, что помогает убирать барьеры, связанные с нарушением прав, с дискриминацией. Вот это вот основной протокол, который должен быть в стране, а сами сообщества, конечно, могут собирать всю информацию, которая им необходима, но государство должно принимать данные вот именно по этому протоколу. Как это будет? Листочки, анкеты, но сейчас, конечно, более оптимизировано, более качественно это цифровые инструменты, это диджитал инструменты, их может обрабатывать искусственный интеллект, как бы для этого не надо много сотрудников, много ресурсов, то есть такой хороший оптимальный вариант на самом деле. То есть я про то, чтобы усовершенствовать этот инструмент. Наверное, все, что хотел сказать.
Thank you. Thank you very much, Sergey, for this comprehensive answer. Krista, would you like to chime in on this topic?
I think the colleagues have really covered the key points here. I know there's lots of questions in the Q&A, and I'm happy to move on to the next one. Thanks.
Thank you.
Or maybe perhaps also, Elena, maybe in terms of one of the successes, just in regards to how strengthening government partnership. And again, as I said, it's important for CLM to belong to the communities, but in terms of how we were working and providing, feedback to the department, right? So other systems like your DHIS2 became a bit more accessible in regards to just data triangulation and just more working on a quantitative aspect of things, right? And then also, as I said, I think I saw another question in regards to looking at other things like your gender-based violence services, because initially when we started, we were not even looking at GBV. But in terms of, just the intersectionality between the two, we just saw data reporting being limited in that side. And then also through collaboration with the department said, okay, perhaps you guys can actually assist us in how we can, see a way this data is actually going, which is why we resorted to monitoring clinical forensic medical services centers, right? So I think in terms of sustainability and also integration, I think it is more on the government side, actually, understanding the CLM models and also understanding how these systems can actually be integrated without compromising, government data, but still making the data to be exclusive to the community as well. Thanks.
Thank you, Malachi, for that addition. Again, one cross kind of cutting question, and then we can go to more specific ones. How can we use the CLM data to advocate and mobilize domestic investments? So now we're focused on domestic investments from government and private sector. Any examples can be shared. So maybe Krista, you can take us first step in this, and then we can go to the specific context. Thank you.
Yes, thank you. Great questions. And thank you everyone for putting your questions into the Q&A. It really enriches the dialogue. I think for me, this is maybe where CLM needs to still mature the most. We are generally good at working with communities to find their pain points, to develop indicators and to monitor. We need to be more sophisticated and deliberate about advocacy. So in most national contexts, there are critical decision moments, maybe creating a national budget or creating a strategic plan on HIV and infectious diseases. We need to do a better job of working backwards to what is the date of that decision and who needs to be influenced, and preparing and packaging our data and analyses to reach those decision makers in enough time to influence those decisions. I think in the earlier phases of CLM, we think the data alone will be enough, people will find it, or it will be convincing. Unfortunately, we find ourselves in a moment where science is under attack. Data isn't necessarily going to be enough to convince all of our leaders. So we need to think about advocacy campaigning and how to truly be sophisticated at our campaigning. And again, to work backwards from decision-making moments so that we are engaging with decision makers in the right period of time. And I welcome input from the other panelists and colleagues.
Да, спасибо, Криста. Я, во-первых, полностью поддерживаю вот то, что сказал Меликай по поводу того, что мы без государства будет сложно, с данными мы их будем показывать в виде презентации где-то на конференциях, но поможет ли нам это изменить ситуацию? Ну, наверное, без взаимодействия с государством точно нет. Однозначно надо создавать площадки, на которых государство вместе с сообществом будет эти данные обсуждать и на основании этих данных менять политики. А вот этот вопрос по поводу, который озвучила Елена, по поводу того, чтобы ресурсы как-то аккумулировать в стране, это как раз и надо делать по наличию данных, по тому, как CLM влияет. Как раз для этого CLM и существует, для того, чтобы вот все ресурсы акцентировать на те пробелы, которые существуют в странах. Там, я не знаю, отсутствие мониторинга лечения, там не закупили тесты, либо там прерывание лечения, либо изменение лекарств не по медицинским препаратам, либо плохая приверженность, соответственно, государство этими ресурсами должно заполнить эту нишу. То есть вот на основе как раз CLM и должно финансирование страновое меняться, сама политика, куда, как донорская, так и государственная, смотря кто финансирует в отдельно взятой стране. Но площадки надо создавать обязательно. Вот такие площадки есть в Центральной Азии, в Украине прекрасная, где все представители сообществ, члены ССМ вместе с государством обсуждают CLM, стратегию, написали тоже теорию изменений очень прекрасную и уже продвигаются дальше. Поэтому взаимодействие с государством и данные, которые изменят ресурсные потоки и, соответственно, политики в отдельных странах.
Thank you so much, Sergey. Melekaya, anything on this topic, or should we go to some South Africa specific questions?
Yeah, no, we can go to South African specific discussion, but I think I also like the comment provided there by Harold in regards to when we talk about governments increasing investment in community-led monitoring. It means that the government is allocating more resources, such as funding, training, and support to initiatives where communities take the lead in monitoring and evaluating the services and programs that affect them. So I think this is actually a good example, and also one of the ways in which, in the South African context, our SANAC, can actually just incorporate that or rather coordinate that mechanism going forward. Thanks.
Thank you, Melekaya. I also spoke too early. I just look at the time. But good news is if all panelists agree with me, because we have some great questions in the Q&A box, that because we will circulate the recording, we will circulate the webinar itself and presentation. I was thinking maybe we can do Q&A document where we will ask our respective panelists to respond to the questions from their perspective, and then circulate to everyone who has been participating on the webinar today together with the webinar itself. So all the questions will be answered. Do the panelists agree with me? Okay, thank you so much. Thank you so much. Just one comment which I find interesting. Fully agree with Krista. Now is the moment to leverage the data generated from CLM in different countries to produce a narrative to rebalance that one that is coming out from the US. So we'll end on this note. Thank you. Thank you so much, panelists, for your energy, investment, your wisdom, your experience provided into this webinar today, and everything that has happened before. And I will give a hand now for the final remarks to Krista. And Gloria, you can please start opening people's cameras for the group photo. Over to you, Krista. Thank you so much.
Yes, thank you. If you're being promoted into the wider panel here, it's because we're going to take a group photo, so don't be surprised or scared. Just very quickly, I really want to thank all of our panelists today. It's a great privilege to have a webinar in Ukrainian, in English, in other languages, to really have this dialogue. Thank you to Dr. Ndemiso for doing all the work to pull together this analysis and being our lead writer, and to Melekaya and Sergey for answering questions in real time and providing context. And of course, to our backend team, Yelena, and also Gloria, who you're not able to see, and Yevgenia as well from HACC, who has been incredibly helpful. 3 quick comments to finalize it. First, finances are shrinking, and that's not going to change. Unfortunately, not only is the US government paused foreign aid, and that's a dynamic situation, but we can also see shifts to the right in France and in the Netherlands and in traditional donor governments. So I want to go back to something that Sergey said earlier. When there is less money, CLM is more important than ever. And communities are exactly who can pinpoint where the problems and the bottlenecks are, and to create the most appropriate solutions. The second is, again, we need to link this data to advocacy more deliberately and more often. Pull in your colleagues and partners who are good at campaigning and who are good at advocacy. Sometimes that's reaching a decision maker. Sometimes that's a public campaign. Sometimes that's things like social media and TikTok. And then third, we really need to work together. I think we've all been overwhelmed and disheartened and despondent at times in the last 2 weeks. It's been scary. People's lives have been at risk. Our communities are at risk. But for me, the silver lining and where I draw my energy is seeing how people are coming together. And this kind of dialogue across Eastern Europe and Southern Africa, seeing people I know who are putting in their time and resources in a voluntary capacity to help document what's happening, to help make sure that this is not happening in silence, is really important. We need to learn from each other and help and coordinate, make the connections across languages and countries. And I find that to be where I draw my energy in this moment. So again, I think this webinar is really indicative of that. Thank you again to all of the panelists. I wish everyone on this webinar courage, all of our participants. It's going to be a long fight, but we're on the right side of history. And back to you, Yelena, for our group photo moment.
Yes, thank you. I see people like Colleen, Emilia, Laura, Shefali, Valeria, Emilia, Mufo. Thank you all for Tinashe. Thank you all. I know we cannot put all the cameras on, but we would like for the institutional memory and our socials to have a group photo. Yes, just waiting one more minute. Hi, gang, soon. Yes, nice to see all the faces. Quite often these webinars feel a bit depersonalized because people are, behind. So it's nice to see the faces, right? Zakaria can have access. Yes, we are allocating as fast as we can. Upgrading you to the panelist status. So now you can even put your camera or speak up, if you will. Jan, okay, Fidel, okay, we are having some critical number of faces now. Hi, Zakaria, nice to see you. Hi, Elsie. Okay. A few more faces. And then, Gloria, you can tell us if we can take the photo now. Melanie, Jan is here.
Yes, we can start taking now.
Sorry, I didn't hear
I
that.
think Gloria was saying in the chat, we can take a photo now. Also, if anyone in the participants group would like to be added, please raise your hand and Gloria will prioritize adding you.
Yes, that's also the maybe fastest way. Not everyone wants to show up their faces. Okay. Okay, maybe we are 2 minutes over time. So I think, Gloria, let's do what we can with the faces that we have here. And then we call it a day. We will follow up, like we said, with the webinar recording and the presentation and the Q&A as soon as we can. And
I'm going to request if people can smile.
Okay.
Actual photo. Thank you so much.
Ansel, smile.
And you have now, if you wish to speak, you can unmute and speak to us. So this is the moment to say hi to someone you haven't seen in a while.
Yeah, like Zakaria, for example. Zakaria, want to say something? Thank you, everyone. Thank you, Krista. Thank you, Dr. Misu. Thank you, Melekaya. Thank you, Sergey, Yakuya. Thank you, Evgenia, Gloria. And to the all participants, and especially our translators from Japanese and French, Ukrainian. Thank you all. Have a good day.
Thank you.
Thank you.
Thank you. Bye.
Thank you,
Bye-bye.
colleagues.
Everyone.
Bye.
Bye. Bye.